Hello, I'm Leann McAllister. I'm Executive Director of the Nevada chapter of the American Academy of Pediatrics. Thank you for giving me a few minutes of your time for me to present our chapter's advocacy priorities for 2021 and beyond. Nevada AAP pediatricians live and work in Nevada and have dedicated their professional lives to the health of all children. At the end of 2020, the Nevada AAP surveyed our 275 members to learn their priorities and recommendations to foster child health and well-being, achieve health equity, eliminate health disparities, optimize lifespan outcomes, strengthen families, support our communities, and enhance the position of Nevada as a leading state for children. The results of that survey are presented in our 2021 Blueprint for Children, currently available in the advocacy section of our website, nevadaaap.org. Our policy goals promote healthy children. All children, adolescents, and young adults from birth to the age of 26 must have access to the highest quality health care so they can thrive throughout their lifespan. Our policy goals recognize the need for family security and stability. Together, we can work to advance efforts to ensure that parents can give their children the best foundation for their future. Our policy goals recognize that strong communities are the building blocks for secure families and healthy children. And lastly, our policy goals call for the elevation and maintenance of child health and well-being as a priority in our state. The Nevada AAP Advocacy Blueprint organizes our members' advocacy goals into categories. Nevada pediatricians are concerned about a wide variety of policy issues. And when asked which were their top priorities, members responded with the following 7 categories. Gun violence prevention that regulates access to guns, including universal background checks, mandatory waiting periods, closure of the gun show loophole, and mental health restrictions for gun purchasers. Childhood preventative care, including eliminating state laws permitting non-medical exemptions to school entry immunization requirements. Tobacco and e-cigarettes, protecting children by vigorously enforcing laws and regulations prohibiting the sale of tobacco and e-cigarettes to minors. Healthcare access and coverage, especially the critical need to keep kids connected to care by guaranteeing 12 months of continuous coverage for children enrolled in Medicaid. COVID-19, especially prioritizing the funding needed to safely open all Nevada schools for families who choose to send their children back. Immigrant child health, granting access for all children and pregnant women in Nevada access to health insurance, regardless of their immigration status. Substance abuse. Punitive measures that taken towards pregnant women, such as criminal prosecution and incarceration, have no proven benefit for infant health. Treatments and programs aimed at supporting mothers to get and stay clean are what's best to provide the best care for their child. Additional advocacy issues important to members of the Nevada AAP include setting medically accurate mandatory sex education standards to empower young people to make healthy, fact-based choices, and setting school start times after 8:30 a.m. for middle and high schoolers to protect them from the significant effects of sleep deprivation. I hope you will read our complete advocacy blueprint for children on our website, nevadaaap.org. While there, I encourage you to learn about the many resources we have for Nevada families, including Walk with the Doc and Camine con un Doctor. These are our free public events where Nevada families learn about a pediatric health topic and then take a walk with a community pediatrician. Prior to the pandemic, we met at public parks in both Las Vegas and Reno. And although our events are currently virtual, we plan to return to in-person events as the vaccine rate goes up and the virus infection rate goes down. Until then, remember that we are all responsible for protecting those at higher risk. Thank you for your time and attention.